Hello, my name is Isa Ramos, and I am a senior majoring in human health and dietetics at UNCG, and I will be graduating May 2021. I am an undergraduate research assistant presenting this poster in part with UNCG's 2021 Thomas Undergraduate Research and Creativity Expo. I am here today to present the current research I am involved in with Dr. DeRode titled Food Insecurity and the Relationship Between Poor Feeding Practices and Health Disparities Among Infants. This study was approved by the Institutional Reviews Board of UNCG and Pediatric Clinic. So why is this study being done? Well, leading health organizations recognize breast milk as the ideal food for infants and meeting all the nutrient requirements, ensuring optimal growth and development. Hence, exclusive breastfeeding is recommended for the first 6 months of life. Despite the recommendations, a majority of mothers in the U.S. do not breastfeed for the recommended time length. Thus, a cross-sectional study was conducted with low-income mothers in Guilford County, North Carolina, to examine food insecurity and its association with breastfeeding and other infant feeding practices. Multivariate analysis indicated that food insecurity was significantly associated with breastfeeding cessation even after controlling for sociodemographic variables such as ethnicity and weight status. Results indicate that household food insecurity also affects infants negatively through poor feeding practices. And in the future, pathways through which food insecurity affects the discontinuation of breastfeeding is warranted. Especially, it is important to understand how stress and intermittent food shortage and food insecurity affect mothers and their ability to continue to breastfeed. Reducing barriers to breastfeeding, such as food insecurity, can help address health disparities in this country. Our methodology for this study were 30-minute interviews conducted in person and over the phone for eligible mothers who met the following selection criteria listed here, such as able to speak English or Spanish, 18 years of age or older, and if their infants were 2 months or younger at the time of recruitment, singleton, full or early term, and did not have major health issues or diet restrictions. Data collected examined breastfeeding self-efficacy of the mother and reasoning for discontinuing breastfeeding prior to 6 months or never initiating. Mothers were recruited from the clinic and interviews were conducted when infants were 2, 4, 6, 9, and 12 months old. Interviews were originally conducted face-to-face, but due to the COVID-19 pandemic, interviews were conducted over the phone. For our instruments, we utilized various forms of recruitment at the pediatric clinic, as shown here in the middle, including flyers provided in both English and Spanish that were posted in waiting rooms. And also, prior to COVID, smaller flyers were handed to interested participants. For our research, here at the bottom middle, Figure 1 is demonstrating the comparison of breastfeeding practices and the introduction of solids prior to 4 months of age by ethnicity. And we can see here that breastfeeding rates were highest among Hispanics, while non-Hispanic counterparts had the highest rate of introduction to solid foods prior to 4 months of age. Next to that, Figure 2 indicates our findings that 21% of participants were experiencing some level of food insecurity, including mild, moderate, and severe food insecurity, as measured using the USDA's 10-item adult household food security survey module. On the right, Table 1 is comparing social demographic characteristics by breastfeeding status. There were lower breastfeeding rates in participants receiving SNAP benefits than those who were not. And then in the common reasons for discontinuing breastfeeding in these participants, these reasons included pain, discomfort, and inadequate breast milk production. In conclusion, despite the evidence and strong effort to promote breastfeeding, exclusive breastfeeding is not very common among low-income mothers. Food insecure mothers are more likely to not initiate or discontinue breastfeeding earlier than secure mothers. Targeted programs are warranted to promote breastfeeding among low-income mothers because even though there is a strong emphasis on the importance of breastfeeding, there are gaps in low-income mothers and also racial disparities present. Again, my name is Isa Ramos, and thank you for your attention.